It's a long journey to begin with. What we do in academia and basic cancer research is try and understand why cancer even starts. What happens? What turns a normally functioning cell into a cancer cell? And then if we can understand that, we can then design and develop interventions. That could be drugs, for example. New drugs against new targets. That's the beginning of the process. That process, though, is a very long process in itself. So that can take 5, 10, 20 years. You've identified the target, you have a drug that hits it, then you have to move that into a clinical study. First of all, you have to show the drug is safe. That's the first study that you have to do. That can take quite a long time. Then once you've shown it's safe, you have to show it's effective. You have to show it's effective against the particular cancer that you've designed the drug against. And you have to show that there are not untoward long-term side effects from using that drug in a patient population. There are a lot of depressing moments, more so than there are highs in this game. And sometimes it is a bit of a game because you really don't know how things are going to progress. You can control so much of the process, but there are other parts of the process that really are out of your control. Some of that begins with funding. Can you get enough funding to drive the process forward at a pace that you would like to see to get the successful outcome? That is difficult. It's underpinned by very strong science, but you always have to be prepared for something that comes out of the blue, something that's really unexpected, and that's when the excitement builds. I didn't know that was going to happen, but I now know what to do with that particular observation. A day's going to come sooner than you might think where we will control cancer, and in fact, we're doing that already. There's collaboration and there's competition, and they go hand in hand. They really do. So you seek out your collaborators to cover the areas that you're not familiar with. And that usually works out very successfully if you're of the same mind. That's really the way that I think the field moves forward. It is through those collaborative interactions. But there's also the competitive spirit. That's important as well. You're trying to compete with the guy down the road, the woman down the road who's made a new observation. You think that's really exciting, but I need to take a look at that myself. Why didn't I think of that? That competitive spirit is really important. So you've got this combination of collaboration and competition that drives cancer research. There's some really exciting work going on, and the evidence for that, we all look for evidence, is publications in top-ranked journals. I think that our fellows have been extraordinary when it comes to the output. The measurement of their success is by these publications. But the other measurement of success is going to come related to the question that you asked earlier about translating what we do into a clinical outcome, into a better outcome for a cancer patient. And I think you're going to see some of that coming about sooner again rather than later. It's an exciting time. It's where we are today versus where we were 5 years ago. We've had some major changes over the last 5 to 10 years. Certainly in the last 5 years, one of the areas that have developed enormously is in what's called immunotherapy. So this has really come to the fore, and we know the first cancer that was being treated successfully with immunotherapy was melanoma, but we now know that this approach can work with multiple other cancers. And we've also got new targets that we've identified where we have small molecules, we call them small molecule drugs. You can bind in those with immunotherapy that's going on now. That's a really exciting development. And so I think you're going to see over the next 5 years, there are going to be a number of cancers controlled, as I mentioned before, that haven't been controlled up until now.